Hello and welcome! In the next 5 minutes, we'll be discussing Legionnaires' disease. You may have heard the name, but what is it really? Simply put, Legionnaires' disease is a serious type of lung infection, or pneumonia. It's caused by a bacterium called Legionella. The illness got its name after a famous outbreak in 1976 at an American Legion convention in Philadelphia, which is how the bacteria was first identified. It's important to know that there's also a milder illness caused by the same bacteria, known as Pontiac fever. Pontiac fever has flu-like symptoms, but doesn't infect the lungs, and it usually goes away on its own. Legionnaires' disease, however, is a much more serious condition that always requires medical treatment. So, how does someone get Legionnaires' disease? This is a key point. It is almost never spread from person to person. Instead, people get infected by inhaling microscopic water droplets, or aerosols, that are contaminated with Legionella bacteria. The bacteria exist naturally in freshwater sources, like lakes and streams in low numbers. They become a health risk when they get into man-made water systems, where the warm water allows them to multiply. Common sources of outbreaks include the large cooling towers used for air conditioning in big buildings, hot tubs and whirlpool spas, decorative fountains, and even showerheads and faucets in hotels or hospitals. Anything that creates a fine water mist can potentially spread the bacteria if the water system is contaminated. While anyone can get sick, some groups of people are at a much higher risk of developing a severe infection. These risk factors include being over 50 years old, being a current or former smoker, or having a chronic lung disease like COPD. Additionally, people with weakened immune systems are highly susceptible. This includes individuals with cancer, kidney failure, diabetes, or those taking medications that suppress the immune system after an organ transplant. What are the symptoms to watch for? The disease usually begins 2 to 14 days after exposure. At first, it can feel a lot like the flu. Initial symptoms often include a headache, muscle aches, and a fever that can rise to 104 degrees Fahrenheit or higher. Within a day or two, more severe symptoms develop as the infection takes hold in the lungs. These include a persistent cough, which might produce mucus or even blood, shortness of breath, and chest pain. Some people also experience gastrointestinal issues, like diarrhea, nausea, and vomiting. Confusion or other mental changes can also occur. If a doctor suspects Legionnaires' disease, diagnosis is fairly straightforward. The most common method is a simple urine test that can detect the bacterial antigens. A chest X-ray is also used to confirm the presence and severity of the pneumonia. Fortunately, Legionnaires' disease is treatable with antibiotics. However, prompt treatment is critical to avoid serious complications, such as respiratory failure or septic shock. Because of its severity, most patients need to be treated in a hospital. Finally, let's talk about prevention. Since there is no vaccine, prevention focuses entirely on maintaining the man-made water systems where the bacteria thrive. This is the responsibility of building owners and public health officials. Proper cleaning, disinfection, and temperature control of cooling towers, hot water tanks, and plumbing systems are the best ways to prevent the growth and spread of Legionella. To recap, Legionnaires' disease is a serious but treatable pneumonia caused by bacteria found in contaminated water systems. It is not contagious between people and is spread through inhaled water mist. If you develop severe flu-like or pneumonia symptoms, especially if you fall into a high-risk group or have recently used a public hot tub or stayed in a large facility, it is essential to see a doctor right away and mention your potential exposure.